Hi, everybody, and welcome to NASA's Space Apps COVID-19 Challenge Virtual Bootcamp. Today, we will be talking about One Health. One Health is probably a concept that you've not heard about, but that's okay. We'll go over it together. I am Dr. Deborah Thomson, and I am a veterinarian and a One Health expert and the founder of onehealthlessons.com. One Health is the collaboration between people who work with other people, so say like physicians, for instance, people who work with animals, so veterinarians like myself, and also people who work with the environment, like environmental health scientists, for instance. That teamwork is called One Health. I have been developing One Health lessons for children and adults, and again, One Health combines three different things: human health, animal health, and environmental health. Right now, onehealthlessons.com is being translated into more than 10 different languages, and they are being taught internationally. Let's go over why we're talking about One Health and how it plays into NASA. Again, the three parts of One Health: environmental health, human health, and animal health. Let's get started with an example. And we're going to speak about COVID-19. In this picture, it's a beautiful environment. This forest is pristine. There are trees that are evenly spaced out. There are animals that are also evenly spaced out. Nobody is competing for shelter, nobody's competing for food. It's a wonderful environment. Everything looks healthy. Now there's been a change. What's the change? You could see there are people in this picture and there are less trees. Those people could have, say, felled those trees and used those trees for timber, or through climate change, some of these plants just simply did not survive. Regardless of the reason, this natural habitat is now shrinking. And when a natural habitat starts to shrink, that puts more stress on the animals. You can see the exact same number of animals is found in this picture compared to the previous one. These animals are now stressed because they have more competition for shelter and they have more competition for food. Sometimes when there's just so much competition, they have to leave the forest. And when they leave the forest, they get near people. Now, there's something called a zoonotic disease, and COVID-19 is one example of a zoonotic disease. A zoonotic disease is a disease or a germ that can hop between different species. So you see here with the interaction between animals and people, there's an increased chance of disease transmission between those species through mutations. The other thing to think about is, for this animal population, even the population that's staying inside this forest here, if they're stressed, they're more prone to show illness. Just like when we're stressed with our cortisol being all pumped up, we're more prone to getting sick and show illness. Now, the third part of One Health, we already covered environmental health, animal health. Now we're talking about human health. The natural habitat here has shrunken quite a bit. These animals are very stressed and they have little option. So they have to either stay in the stressed environment or seek food and shelter elsewhere. In this elsewhere area, that's where people live. And what did I say before about a zoonotic disease? A disease that can transmit between different species? Well, it's not the healthiest situation for people to be near animals when they're not naturally supposed to be near each other. Let's go through an example of One Health with a story. In this example, through climate change or another way of natural habitat destruction, there's a species that goes away. This species is represented by these birds. Now, once these birds go away, there are going to be 5 changes in this simple ecosystem example. 5 changes by having one species missing. Let's see. Those 5 things. Number 1, you see less trees. Why are there less trees? Because, number 2, there are less birds. Birds can serve as pollinators, and they can eat seeds and disperse seeds. They can also eat mice, depending on the type of bird. But when the predator leaves, you're going to see more prey, as in more mice. When there are more mice, there are more foxes. Why are there more foxes? Because foxes eat the mice. There's a more food supply. And last but not least, there are more animals near people. And what does that do with the risk of transmission of a zoonotic disease? It increases. And keep in mind, COVID-19 is an example of a zoonotic disease. Again, those 5 changes: no more birds, because birds had to either leave the forest or they went extinct. Less trees, birds are pollinators and they disperse seeds. More mice, because the birds went away. More foxes, because there are more mice. And more wild animals in human areas, because there are humans in the areas where wild animals used to live. That is One Health. Again, environmental damage that can be caused by people's actions. Climate change, timber production. These animals are stressed out. They have to compete to live, right? There's a short food supply. They either have to leave the forest or compete. And they live closer to either animal neighbors or people. Just like for people, whenever animals are stressed, they can show more signs of illness. And also, just like for people, animals can carry germs that don't make us sick, but once it transmits to another species, that's when it can cause a problem. Just like COVID-19. People are taking up the space where animals were once living. This brings animals much closer to people. Some people eat wild animals, either through necessity, because they have no other protein source in their diet, or they like it as a delicacy. Or it could be a cultural thing. So people can go to wild animal markets and go to areas where there are different animals from all different regions that are not necessarily meant to be close to each other, including close to people, but they are. And that increases the risk of zoonotic disease transmission. Some germs are zoonotic, and some viruses can mutate. And we have seen with SARS-CoV-2, or the novel coronavirus, causing COVID-19, that it has been mutating. Now, how does COVID-19, One Health, and NASA all come together? Well, let's connect the dots. Earth observations for real-world applications. NASA is all about that. Health and air quality. Think of, for instance, how pollution can affect your health. Are you an asthmatic? Something to think about. By the way, cats can also get asthma. Disasters. What can flooding do to affect a person's health or an animal's health? Think of farm animals out there. Ecological forecasting. Wouldn't it be nice to predict the future? Food security and agriculture. Water resources. Capacity building. Overall, looking at the global ecosystem. Remember, One Health comprises at least 3 things: human health, environmental health, and animal health. But with this COVID-19 response, we are getting much more than that. We are getting ecologists and sociologists and mathematicians and physicists, all different people from different walks of life and specialties working together to make sure the environment stays healthy, people stay healthy, and animals stay healthy. And that is what is called One Health. Thank you.